Joining us is Damian McHugh from Momentum Health Solutions. Damian, appreciate your time this afternoon. Just very quickly, let's talk about the NHI bill recently, how you think it will address the issue of limited access to healthcare among the youth in South Africa, particularly those who are not voluntarily joining medical schemes or have employers ditching compulsory membership.
Yeah, good afternoon, Hugo, and good afternoon to your viewers. Absolutely. I think what we see in South Africa is a challenge, and hence why we are looking at a national healthcare system as a country, is the vast majority of South Africans aren't covered by private healthcare. There's 9 million or so people covered in the private healthcare system. And as Dr. Crisp said earlier, almost 61 million people in the country. So that leaves, 52 odd million people uncovered by health. And generally speaking, private healthcare insurance is quite expensive. The youth, when I was one, I had a similar view, is that when you're young and healthy, you're bulletproof. You're not going to get sick. You're not going to need cover and so on. So we generally don't see youth joining medical schemes voluntarily because A, it's expensive, and B, you think, well, why am I paying this premium if I'm not going to be healthy? If I am healthy, not going to be sick. I mean, I think that's some of the energy that we see within the youth, and I think that's a bit of a challenge for both the private healthcare industry and one which we need to address. I think, firstly, the national healthcare system is still going to take a few years to deliver the quality of care that Dr. Nicholas Crisp and the rest of the department is envisaging. It's going to take some time to get through the different processes that it needs to go through in provincial, parliamentary, processes, I guess. So I think it will take a bit of time, and in that time, youth can still get sick. We can still have people who are uncovered getting ill, and we just think we should be cautious about saying, well, national health is coming next week or next year or the next 3 years, and therefore I don't have to belong to any healthcare cover because it's going to protect me. Lots of things can happen to your health in a very short period of time. So if you can afford it, I think it's still incredibly important. Your health is the most important asset you have. So make sure you protect it, and protect it while we wait for the national healthcare system, I think is important for us, no matter how old we are, but particularly as youth. And even if that means you're just buying a hospital plan, or you're buying some form of day-to-day cover, at least cover yourself for the areas where, you are at risk, and make sure that you have access then to quality healthcare. The private sector still provides unbelievably good access and quality healthcare. The public sector less so. We still have some challenges in the public healthcare sector in terms of quality and provision of care. But as Dr. Crisp said in the piece just before this interview, there is work towards improving that prior to a national healthcare system.
Well, Damian, there are lots and lots of questions that remain unanswered. Now, the NHI bill aims to introduce universal healthcare financing in South Africa, but concerns have been raised about its funding model, amongst others, and potential underfunding. How would you address concerns about the sustainability and financial viability of the NHI in providing adequate healthcare services, particularly for young people?
We in our submissions to the various bodies and parliamentary committees, one of the things that we suggested was more of a partnership between the public and the private healthcare system. A single fund, a single health or single provision system doesn't have to be the way that we implement national health in South Africa. There are many different models and different types of systems that can be implemented over a period of time. And one of the ways that we think we can help as a private sector, help the public sector and help government in the rollout of a national healthcare system is using a multi-funder system, not a single funder system. Now that means that not all the onus of funding rests on government, and we think that is a better stepwise approach to implementing a national healthcare system in South Africa, where funding in the public sector is, let's be honest, our economy is under a lot of pressure. So we think that, using the private healthcare system, with the expertise that it has, both at funding and administration level, provision of healthcare, is a way in which, the partnership of public and private together could provide a better healthcare system for all South Africans. So that's one of the ones that, one of the areas that we suggested in our submissions to Dr. Crisp and his team.
And very, very quickly, Damian, how long do you think it will be before this NHI sees the light of day?
Look, I'd love it to be earlier. I think we see the challenges in a national healthcare, in our healthcare system as it stands now. But there's quite a lot of process still that has to be, that has to go through. As I said, there's still a parliamentary committees that it needs to go through. We are hearing from some other people in the private sector that there are legal challenges that may be brought to this bill. So I think there's still some legal process that will happen, and then still once it's signed off and it's enacted, I still think there's some challenges in rolling it out. So probably 3 years at best, 5 to 10 years maybe. That obviously depends on Dr. Crisp and his team, but it could be anything from 3 to 10 years prior to it, getting through. But I don't want to say it's going to be 10 years. I think that's probably too late. So yeah, in the next 5 years or so, we should start to see it being rolled out.
Damian McHugh from Momentum Health Solutions, appreciate your time this afternoon.